knowledge and expertise.
Excellent.
All right, I'm going to hop off here.
Well, thank you for having me. And just, I guess I would tell you just a tiny little bit about myself. I do have two boys. They're quite grown. One is 23 and one is 19. And my breastfeeding experiences with both of them are different. So breastfeeding can be individual. And so just because you learn it once, you may have to learn it again with each child. That was the lesson I learned so long ago. I wanted to kind of start with the AAP Policy Statement. The AAP is the American Academy of Pediatrics. This is what our governing body, the pediatricians who are in this group, they study all kinds of things related to overall health. And so when we talk about the AAP policy statements, these are things that pediatricians across the country have studied and have thought to be best practices. So for the American Academy of Pediatrics, they do recommend that you don't give water, juice, or solids in the first 6 months of life. Think about initiating iron supplements really only if your pediatrician recommends it. We want you to include iron-rich foods or supplements after 6 months of age. We want you to supplement with the vitamin D daily and provide fluoride after 6 months if the household water supply is deficient. And I'm glad that Dr. Haas actually talked about this because I find also the fluoride, it's been confusing and it changes every year or every couple of years. So always talk to your pediatrician or your pediatric dentist when you're trying to figure out what to do about fluoride. That's the policy statements. But for you, I just want you to think about what are your personal goals? We want to help you meet your personal goals, and there is no right or wrong. So you can do whatever feels right for you for breastfeeding. For some people, they just want to try it a day. And I actually do recommend even 1 or 2 days of breastfeeding can be beneficial to your baby because that's what you're giving your baby as your very, very first food intake. When babies, Dr. Watson talked about the meconium stools that are coming out. The meconium is like I think it's a place filler. So that all of that meconium has to come out and then digestion begins. So the very first thing that you give your baby is important. Could be breastfeeding, and I really would encourage you to try it if at all possible. Maybe you just want to do it for a month. A month is still good. That gives you the very first month of life. Some people just want to do it for 6 months. That's their goal because at 6 months, you're going to transition to more solid foods. So you get the first 6 months of the baby's life are absolutely the most critical for baby nutrition. And in the second 6 months, we are focusing more on some solid foods. But that can be a very acceptable goal. Some people say, yep, 12 months, I'm going to do what the AP recommends. And some people really, frankly, love it so much they want to even go further. The best advice that I ever got for when it is time to stop breastfeeding is really based on when you're ready to stop and when your baby is ready to stop. So every baby's different. And so you just have to go with it. My first child, I was going to definitely just nurse for 1 year. And we didn't stop till he was 2. So for the second baby, I said, well, we're definitely going to do 2. And he stopped at 1 year. So there has to be some flexibility in all of this. But I do want you to do kind of what feels right for you and what works with your baby. And there are goals that you can work on with your family and with your pediatrician to make sure your baby is healthy and grows up strong. So how do you get started? One of the things is once you kind of sort out for yourself, well, I'm going to try it. I want to at least try it. Make a plan. Make sure you discuss it with your obstetrician and your pediatrician. In the very first, that very first hour, they talk about the golden hour, and it really is true. Babies are born with an intense instinct to breastfeed. So you really want to get them onto the breast in that first hour. And every hospital across San Diego is aware of this. And so all of your postpartum nurses are very going to want to get that baby onto the breast in that first hour because it really is an important hour. The colostrum is it's the very first food that comes out of your breast. So it doesn't look the same as regular milk or like regular breast milk. And it has proteins and probiotics and antibodies and a lot of things that are very beneficial. And the colostrum is there for about the first 2 to 3 days. So your milk doesn't come in for just a little bit. So, there will be a transition of when your milk actually comes in. The colostrum is still very important. And some people get frustrated. They feel like I'm not feeding my baby real milk, but that is not true. It really is a valid and important nutritional um, um, piece of what you need to give your baby. So, unless there's a compelling reason to add any other supplement, the colostrum actually works for the first 2 or 3 days. After 2 or 3 days, the actual milk will come in and it'll change color. It'll look more like what you think of milk. That's kind of a common concern for a lot of moms. Will I have enough milk? I think one of the things that I've noticed with a lot of moms is they like to give the idea of giving a formula in a bottle is very appealing because the bottle comes with a measurement, so you can tell exactly how much milk your baby's getting at every feeding, and that can be very comforting for new moms. Breasts don't come with any measurement, so it's hard to say like, did my baby get enough of that feeding? How do we know? Well, this is why those early pediatric visits are so critical. The schedule has totally changed. A lot of newborn books or care books actually state that the first pediatric appointment should be at 2 weeks, but we know that that is not the right time. We need to get that pediatric appointment within 2 to 3 days after you discharge from the hospital so that we can monitor the baby's weight. And that's why that first appointment is important. In order for you to have enough milk, we need you to sleep, we need you to eat, we need you to drink. Drinking water, the mother's tea, all of that kind of stuff will help to make sure that you get enough nutrition and that your body produces enough milk. Naturally, breastfeeding, new moms actually will naturally produce milk. It really is not usually a problem with the moms. We just have to kind of work with you a little bit. There is a concern for, this is why some moms get concerned about, do I have enough milk? Is because if jaundice comes in, and we do monitor that very closely now, it'll be monitored in the hospital. It's one of the early tests that get done before you leave the hospital. It is a concern, but we will guide you through this whole process. I think Dr. Misson talked about our 10% weight loss is a concern. That's kind of been the mark. Like we know that babies are born with extra fluid so they can get through the birth canal. So we know that it's extra water weight. Babies will lose that weight in the first week of life, and it's fine for that baby to lose a little bit of weight. 10% is when we have to start thinking about, well, how much more support do we need to give you to make sure that you're going to be breastfeeding adequately? So that's another reason why seeing your pediatrician in that early time is important. Well, what happens if you're still feeling like it's not working? Lactation consultation, that is a new thing. That was not such a force, 25 years ago when my kids were first being born. But lactation consultation and the growth and support of lactation has been huge. We now know that almost all of the health plans cover it. So because they see the benefits of breastfeeding and they want all of our babies to breastfeed for as long as your personal goals are there. You will most likely get a lactation consultation in the hospital. So you'll get it as an inpatient. You can also get it outpatient. And the reason I say this is because sometimes I have a lot of moms who kind of, the first couple of feedings seems like it's going well and they feel like it's good, but then they get out home and there's new struggles. So don't be shy about getting a lactation consultation. Throughout our offices at CPCMG, our goal is to have a lactation consultant in almost every office. We have kind of met that goal now with having regional lactation specialists, but more and more of our pediatricians are actually certified as lactation specialists. So we have that available for you. And I do think it's important to work with pediatricians who want to help support your lactation goals. So what do you need to do? There's breastfeeding positions. I remember years ago, my sister-in-law coined the term around the world breastfeeding. It is important when you're breastfeeding to breastfeed in different positions so that at every different position you're doing, you're emptying a different part of the breast. You can see on the left, there's a picture of the baby newborn with what your breast actually looks like. Those little finger-like projections are what holds the milk, and they are finger-like projections, and they fill up like sausages. So when you're not lactating, your breasts are composed of mostly fat tissue or adipose tissue, which is soft. As the milk fills that breast, all of those finger-like sausage projections will fill. And it can fill to a point where your breast is literally rock hard. And we don't want to get you to that point because then you would have, that's it, engorgement situation, and that can lead to complications for mom. So we want to make sure that you don't end up with a breast infection or what we call mastitis. The latch is the most important thing. On the left side of that picture, you see the baby's face is really smashed into the mama's breast. To get a good latch is how you're going to be successful with breastfeeding. And I think sometimes what happens is babies, when they're on the mom's breast, they tend to want to nurse strictly on the mom's nipple. And when that happens, that can cause more damage to the mom's nipple, and it can lead to ineffective breastfeeding. So we want to really help you to get that latch so that it's appropriate and you're getting a deep latch so the baby is drawing the milk from the deep part of the breast, and that's going to cause the full milk letdown and the milk to come through. So that is kind of mission critical for what you're going to do and how you're going to do it. And I find when you're expecting a baby, it's very difficult to look at these lactation pictures and understand what it's supposed to feel like or what you're supposed to do. But in the first 2 weeks of life, with support, we can get your baby to breastfeed. And it's really something we love to do to help you. So just want to throw in a little bit about how sometimes dads or your partner feels like, well, I don't have a role here, I can't breastfeed. But that's actually not entirely true. There's a lot of things that your partner can do to help you, helping you to support the baby, helping with the latch to make sure that latch is appropriate. So the pillows and getting the baby, putting yourself into a comfortable position will help all of that happen. I think sometimes with when we're breastfeeding, moms want to use the breast as like a third arm, and it's not. We want to, instead of moving your breast to the baby, we need to move the baby to you. And so I like this photo of the dad kind of helping that mom, helping her to get that baby to the breast and in the right position so that the baby can have a good latch and can really get an effective breastfeeding. If your partner is questioning why you're breastfeeding at all, we need to have that discussion with your baby's father or partner so that we make sure that everybody is on the same page. And that way we can get everything, we can help you to reach your goals. It's frustrating, I think, for moms when the breastfeeding doesn't go well because they feel disappointment sometimes, but that's where working with your pediatrician, we were there to help support you to reach your goals. And this is a team effort. So your team includes everybody in your extended family, your village, if you will, to say, your partner, your support group, your doula, your OB, your pediatrician, grandparents that are available, and sometimes even the neighbors. Depending on what your village is, you define your own village for who's going to help you. But we're all here to help you to get to where you need to be.
Amazing.
So this is our final slide. So there you have it.
Yay. And we posted all of this information in the comments as well. Just to kind of wrap up here, you are at Pediatrician at the Vista location for Children's Primary Care Medical Group. And that was so much great information. I know breastfeeding for me personally was very difficult and latching. So I really loved that last slide where you're kind of talking about getting your partner involved. I think I wish I had that information. So amazing. And it looks like we did have a question or two in the comments, but to kind of push along just in our schedule, we will kind of go forward, but we will definitely reply individually in here. And I will circle, unless maybe it's a quick answer, we'll do it. Is a mom currently breastfeeding? How can I stop my baby from painfully pulling away from the nipple?
So when a baby is latched, you can't just pop that baby off. So that baby is truly latched. So you actually do need to release the latch before you actually, you have to release the latch before you do it. But there is such a thing. Sometimes babies don't get that. And they do kind of do this rubber nipple thing with you where I'll just know, like they're attached and something goes over and they just pull over. So they kind of just pull it away. So you have to be able to release that latch. So you have to actually, teach that baby that, when they want to come off, you release the latch and you manually need to release the latch and it won't pull your nipple so hard. And that is also true for biting. When babies get to be older and they start to bite, some moms stop breastfeeding, but you can teach your child that no, biting is not okay. And they do get it because they prefer breastfeeding to anything else.
Totally. Well, thank you very much. I so appreciate your time and expertise, and we are so grateful for our partnership and just everything you shared today. So thank you.
All right. Thanks for having me. All right. Bye-bye.
Bye.